The formularies are basically calculations for that specific drug plan. And every single formulary is different. Every single drug plan and every single company covers medications differently. There's also companies that have multiple drug plans. So, how do you make sure that your drugs are covered? I'm going to show you that too. But the best thing to do is to make sure that you have a representative like myself. So let's look at, first and foremost, I'm going to share my screen and I'm going to show you the formularies, like an example of the formularies. All right, so what we're going to do is we're going to share. And so a tool that we all use when it comes to looking up drug plans is always just Medicare.gov. I mean, Medicare.gov gives you the most accurate. There's other platforms out there, but for the beneficiaries and the consumers, this is the most logical one for sure. And all you have to do is just click Find Health and Drug Plans, put your medications in, and it shows you exactly what you should use. So let's just use Mississippi zip code because that's where your boy is from. We're gonna put in here. So you have these questions you just have to go by. Do you get help with your drug costs? All right, so let's just pretend no, we don't get help. If you get extra help or anything like that, guess what? You're gonna have like very, very little cost. If you get extra help, you just have to make sure that the medication is in the formulary. So back to formularies. If it's not in the formulary, then it's not covered by that drug plan, and you will have issues getting your medication. If you have extra help from the state doesn't, it's not your primary insurance. It's your secondary, really, kind of, right? So it comes in and pays the majority of your medication, but it has to be in the formulary or you will run into issues. Do you want to see drug costs? Yes, it's the whole point. All right, so let's just put some basic medications in. We'll put amlodipine, a little blood pressure medication. We'll do rosuvastatin, cholesterol medication. We'll do, and actually we'll just do a, let's see what I'm taking, right? So for my old brain there. So 75 milligrams clopidogrel, and we'll go with, so we have a blood pressure, a cholesterol, we have a blood thinner. Let's do a, like Trelegy. Trelegy is for breathing, probably for people who have like, breathing issues, maybe COPD, maybe emphysema. It's probably gonna have a expensive medication there. I'm trying to do expensive because I want to show, expensive. That's what I want to show. So we want to put a few different options here for pharmacies. Continue to view plans. So we got Walmart and CVS. All right, so in this area, the best one is the Blue Advantage Magnolia PPO. It says $120 for total drug and premium costs for 2025. No matter where you're at in the year, when you look up on this site, it's going to show you for the remainder of the year what your costs are. So in January, if it's $120 for the last quarter, just do the math. It would probably be like $480 for the whole year, which is really good. Then you have United Healthcare, which says it's $400 roughly for the rest of the year. That would put it at like $1,200 for the whole year. Hope that's making sense for you now. So with this medication, Trelegy, that's the one that's jacking it up, because if you take Trelegy off, it's going to be very, very low cost. You would look at the plan that has the lowest cost, and you'd go to it and check it out. So right here it says Trelegy, cost of Trelegy. So that's the only one that's really costing a lot of money. At CVS, it's $15 for every drug except Trelegy. Here it is. So at Walmart, you're paying $120. This is your yearly drug cost by the pharmacy. So what it's doing is it's taking every month and adding them together. So you're paying $40 per month. That's probably going to be a year-wide thing. So what's 4 times 12? It's $480 is roughly what you're going to pay, like I was saying. So these formularies, so the plans have formularies, right? So how do we look at the plans for the formulary? I'll show you one way. Let's see if it's on here. So let me just tell you from a representative and a professional standpoint, let me just tell you this. You don't need to do that much research. You don't need to dig in. You don't need to, I need to know. You don't need to know every single little detail. You need to know how much are your medications gonna cost. Take them, put them into that platform, and that platform will show you which medications are being covered and which aren't being covered. Now, there's so much more to go into this, right? You don't just go in and sign up for the plan that has the best drug coverage. You might need to do a little mix, right? Maybe one plan has the best drug coverage, but it also costs you the most at the hospital or the doctor or whatever. So you have to look at these things. This is why you have to have a professional like myself or one of my team members to go over this stuff with you in detail.